So hello again. And now for the most interesting topic of the day, organ transplantation. So there's of course the big question, is organ transplantation accepted in Jewish law? And I'll tell you honestly, from my experience, a lot of people do not know. And I'm talking about even about rabbis and people that know about religion, they have no idea. Is it allowed? Is it permissible? When is it? When is not? So I'm just going to try to clarify a little bit this concept. So organ transplantation is one of the most challenging and complex areas of contemporary medicine, as well as in medical ethics. Organ transplantation can be life-saving for patients with organ failure, and thousands of patients die every year because there are not enough donated organs to meet the demand. But there is an important gap between the high demand for organs and their scarce supply. Over 89,000 US patients are currently waiting for an organ transplant, and nearly 4,000 new patients are added to this waiting list every month. Because of the lack of available donors in the US, about 4,000 kidney patients, 1,800 liver patients, 450 heart patients, and 500 lung patients die a year while waiting for life-saving organ transplants. That's roughly about 20 a day. So one every hour and 10 minutes. And this is only in the US. So today, most deceased organ donors are brain dead, and most organs are obtained from accident victims. So these donors are clinically and legally declared dead when they have lost whole brain function and their bodies are kept alive only because of a mechanical ventilator. So the definition of brain death in Jewish law is debatable according to different point of views, and this is what I'm going to try to explain. So organ transplantation raises a number of bioethical issues because the definition of death varies according to legal, philosophical, or religious standards. So, organ transplantation from live or dead donors has been abundantly discussed in Jewish law. For most, it is considered as a mitzvah, I mean a good deed, when live donors give blood, kidney, or bone marrow. Okay, you can go home. No. Okay, we're talking about live donors. But when major organs such as liver or heart have to be taken from brain-dead donors, the difficulty arises when evaluating the right time to remove these organs, if the donor is still considered to be alive according to Jewish law or not. So we know that the human brain consists of three main regions: the cerebrum, the cerebellum, and the brainstem, which is in the center. Now, the brainstem controls, of course, the breathing reflex and other reflexes. And if the brainstem is intact, the patient is still able to have spontaneous respiration and heartbeat, even if the other parts of the brain have been severely damaged. The official US law, and also the Canadian law, by the way, states that an individual who has sustained either irreversible cessation of circulatory and respiratory functions, or irreversible cessation of all functions of the entire brain, including the brainstem, and this is the important word, is dead. Which means if the brainstem is not included, it is not in the official definition of brain death. So the determination of death must be made in accordance with accepted medical standards, and all the details of this law. So this important controversy among Jewish lawmakers and rabbinical authorities on the acceptance of brainstem death as a definition of death. So, sometimes we're going to hear brain death as one side of the brain being severely damaged, but for sure in Jewish law, when we're talking or we're speaking about brain death, we're talking about the brain stem. So as long as the brain stem is not touched, there's no question of brain death. So even when the brainstem is damaged or completely cut, The discussion is whether this is accepted or not as brain death. So for Jewish law, it is critical to establish whether brain death is an acceptable definition of death for various reasons, and mostly for organ transplantation. In a situation where a heart is to be removed from a donor declared brain dead while still beating, death has to be confirmed even when the breathing is only artificially maintained. For some, death is the irreversible cessation of both respiration and heartbeat, or cardiac death. And if these criteria are not met, there is no death, and everything must be done to provide full support to the patient. If it's connected to a respirator or to a ventilator, we may not withhold it. Others rule that only if respiration irreversibly stops, it is considered as death, and thus consider absence of brainstem activity as definite death because of the absence of autonomous respiration. So we see here that we have two opinions. So the first, on the first opinion, so these rabbis will agree to the removal of her heart or other organs from her brain dead patients. And for the others, of course, since brain dead is not considered as dead according to halacha, or to Jewish law, heart, liver, or other organs that have to be taken while blood is still circulating cannot be removed, so making transplantation of major organs almost impossible. So this opinion one, this first opinion, is of Rabbi Yosef Shalom Eliashiv, which is the leading rabbi today in the Ashkenazi ultra-Orthodox community. He published the rabbinical ruling stating that if the heart is still beating, brain death is not sufficient to allow harvesting organs. And this is an important opinion in the religious Jewish world. Okay? It's a very respected current of thought. So in his opinion, without cardiac death, I mean, as long as the heart is beating, whether it's through a ventilator or through a machine, there's no cessation of breathing, no one can be considered as dead. The opinion number two, and this is what I'm going to do, just give you both opinion. The opinion two, in 2009, in an unanimous vote, the Supreme Rabbinical Council of Israel, which includes the two chief rabbis, which is this one Ashkenazic rabbi and one Sephardic rabbi and all the rabbis that are around this court, voted for a new Israeli bill, a law, which provides directive for deciding when a person is to be considered brain dead and to permit the disconnecting of the patient from life support for the removal of organs for organ transplant. So, of course, in accordance with halacha. So numerous tests must be confirmed brain death, and I'll go through the tests. So we see here that we have two completely separate ways of saying brainstem death as halachically acceptable death. The test that they have asked in this law is first, there should be a brainstem auditory evoked response test, BAER. There should be a transcranial Doppler test, a TCD, a somatosensory evoked potential test, an SEP, and either a computed tomography, a CT exam, or an MRI to examine the flow of blood in the brain. And the panel even moved to add another procedure known as a carotid angiogram, which is a test which looks for blockage in the neck arteries that supply blood to the brain. Once these tests have been done, then there are even more conditions. The incision to remove the organs must be limited to the absolute minimum necessary and only for the organs in question that are required to save the recipient's life. All other organs and tissues must remain within the body and be provided promptly for burial. So these rabbinic authorities who accept complete brain death as acceptable halachic are Rabbi Moshe Feinstein, which we talked about, which is one of the main halachic Jewish law authorities of the modern era, who stated that if a donor is positively dead by medical and Jewish criteria, there is no murder of the donor and it is permitted to transplant his heart into another's recipient. There is a little bit of controversy about this statement, but we will not get into that. Okay? And also the RCA, which is the Rabbinical Council of America, also officially accepted brainstem death as halachic death, following the psukim of their chief rabbi, which is Rabbi Tendler. There's also the Chief Rabbinic Council of Israel, which under this Knesset bill, like we just said, and also the Sephardic Chief Rabbi of Israel, which name is Rabbi Shlomo Amar, and the spiritual leader of the Sephardic chess party, which is Rabbi Ovadia Yosef, which is a big posek. In Hebrew, posek means is a big, how would you translate posek in decision, law decision maker in the Jewish law. It's written numerous books. Also, has ruled that brain death, brainstem death is acceptable as brain death. There is even a Jewish organ donor organization, which is called the Whole Society. So it educates Jews around the world about the Jewish law and medical issues surrounding organ donation. It even allows all type of condition, when is it acceptable, and whether you are with the first opinion or the second opinion, whether you can carry the card and accept brain death to donate organs, and all type of conditions that make it halachically acceptable for everybody. So, when I have a question, and it happens in the hospital, because in the hospital we do have now a nurse that only takes care of organ transplants, of organ donors, and this question about the Jewish patients. The question is, I mean, of course, is it permissible? Like the family will come, somebody's in the ICU and is dying. And sometime, well, if it's been written and in his will that he accepted to give organs, then the question is not asked. But sometimes the family does want organs to be donated, but they have a doubt whether it's acceptable in Jewish law or not. So then they will come to me, or maybe to another rabbi, and ask, is it allowed? So of course, my answer, or the answer of another rabbi, I think, will be depending on which side you are. So if you are on the side of the ultra-Orthodox Ashkenaz, which is Rabbi Eliashiv position, then brain death is not accepted, then organ donation or major organ donation is not acceptable. But then, if you are on the other side, which is the government of Israel position today, that according to all the tests and everything is done in order, and the brainstem death is confirmed 100%, then under certain condition it can also be accepted. So then, as a conclusion, we agree that when it's a live donor, it is a mitzvah, it is a good deed to give organs to save someone's life, or even just to help someone else. But when organs have to be taken from brain dead donors, there are two opposing opinions. So this is position 1 and position 2. And I made this talk a little bit shorter because in this talk we are going to include euthanasia in the same hour that we have. So for the panel, we'll answer questions both on the organ transplantation and also on euthanasia.